It's a scandal. It's a tragedy. It's an outrage. That we don't provide basic care. We don't do very much in terms of public health. We don't do very much in terms of prevention. It's one of the things about our society that is most out of phase with our needs and our best potentials. It's actually a source of great pain to me and to everyone who's noticing how badly askew it is. And that includes, by the way, the doctors and the nurses and who are pressured and don't have time and to educate themselves or their patients or actually even be present in a human way. The degree to which profit and profit-seeking, profit motive has sucked the spirit out of healing and medicine and replaced it with something that's unworthy of us as human beings. It's one of the places, I mean, if I was a young person, I wouldn't want to be a doctor. I wouldn't want to be a nurse because the system is so outrageous. And what does that say? That you wouldn't want to go into a healing profession. It says something very sad. Well, I think, first of all, we have to take note of the tremendous role that food plays in our lives and our health. And we need to start subsidizing the healthy foods and taxing the ones that aren't. A simple example of that is to put a tax on white bread and use the revenue from that to subsidize whole wheat bread. Because right now, if you go into if you're living in an inner city, you go into a convenience store, it's all cigarettes and junk food. And there's nothing that you can eat. It's easier to find a Hershey bar than it is to find, or a pack of cigarettes than it is to find an apple or an orange. We need to start making healthy food, simple, basic foods, like whole wheat bread, like brown rice, like other whole grains, like fresh vegetables in particular, and the whole range of them, available and inexpensive for people. And let's fund that subsidies, by taxing the junk food. We all know what they are, and that'll make them less attractive to purchase because it'll raise their prices, and it'll make it more attractive to purchase the healthier foods because they'll be less expensive. And I think that is the right use of government, and I think it's the right use of our collective will.